Even if you're still in your first few weeks of nursing school, you've already realized they never test you on only chapters 5 and 6. It's more like chapters 5 and 6 and 7 all the way up to 15. But buried there somewhere in that massive amount of information is the most important information. Only you don't have time to figure out what that is because you're too busy reading every word of your textbook, which you don't actually have to do, by the way. But that's a whole other video. Drop a comment if you want me to do a video on how to skip reading the textbook word for word and still pass all your classes. But today, I'm not only going to walk you through 3 NCLEX style practice questions on critical thinking from your nursing fundamentals class, I'm also going to show you how you can study this way for yourself before your exam so you can walk into your test feeling confident and still feel confident walking out of your test too. Let's get started.
Question 1. A new graduate nurse is reflecting on a recent clinical experience where a client's condition unexpectedly deteriorated. How can reflection improve the nurse's capacity for making future clinical decisions? A. By allowing the nurse to identify knowledge gaps and seek further education. B. By helping the nurse recall specific clinical guidelines and protocols. C. By enabling the nurse to memorize procedures for similar future cases. D. By encouraging the nurse to focus only on successful interventions from past experiences. Pause if you'd like to think about it before I reveal the answer. The answer is A. By allowing the nurse to identify knowledge gaps and seek further education. Here's how you can correctly answer this question on your own test. First, you need to ask, what did I need to know in order to answer this question? In this case, really knowing what they mean by the word reflection is pretty much all you need to know. I want to share with you one of my studying hacks that I usually only give to my tutoring students. That can be essential when you are a first semester nursing fundamentals student. And that is the correct way to use learning objectives when you are studying so that you don't have to read the entire chapter. If you had studied using the learning objectives, this question would have become easy. And that's because one of the learning objectives for this critical thinking chapter was this. Discuss how reflection improves a nurse's capacity for making future clinical decisions. That was one of the maybe dozen learning objectives at the beginning of the chapter. And when we look at that learning objective during our study time, we ask ourselves one question. It's very similar to the one question that rules them all that I teach as a test-taking strategy. And I'll make sure to link to that video at the end of this one, just in case you still need to learn it. But the learning objective question we ask is, what do I need to know to be able to have an intelligent discussion about this learning objective? It helps your brain to focus and clarify on the most important information because it turns an abstract learning objective into something concrete that you can actually study. Let's look at the learning objective about reflection again. Discuss how reflection improves a nurse's capacity for making future clinical decisions. That sounds very abstract, but if we ask the question, we would say, what do we need to know before we can have an intelligent discussion about this learning objective? And what we would need to know is, what is reflection and how does a nurse use it? And then instead of reading your chapter word for word, you can skim through, find the section of your chapter on reflection, make sure you understand what reflection means in the context of nursing and how to use it. Once you know that information in your study time, you can be confident that you studied the correct information, and you would have been able to more easily answer this question also. Question number 2. Which level of critical thinking is characterized by the nurse's ability to independently evaluate and interpret data, leading to the development of new approaches to client care? A. Basic critical thinking. B. Complex critical thinking. C. Commitment. Or D. Reflective thinking. Pause if you want to think about this before I give you the answer. The answer is B. Complex critical thinking. Let's talk about how you can answer this for yourself on your next exam. This question might sound a little bit like gobbledygook, unless you studied using the learning objectives method that I just explained in the first question. That's because one of the other learning objectives for this chapter was compare and contrast the 3 levels of critical thinking. During our study time, we should have asked ourselves, what do I need to know to have an intelligent conversation about this? And it immediately becomes clear that we would need to know what the 3 levels of critical thinking are, because we cannot compare and contrast them unless we know what they are. But once we do know what they are, once we have their definitions, then you're a grown-up, you know how to compare and contrast things. It becomes a lot easier to understand. If you've ever heard me talk about my silver bullet study system, you'll notice that the learning objective style of studying is very similar to what we do in step 1 of the full silver bullet study system. Because in a way, we are identifying what do we need to know about normal, when it comes to the levels of critical thinking before we can compare and contrast and think about the levels of critical thinking. And I'll also link to a video about my full silver bullet study system if you need that at the end of this video. Question 3. Which reasoning process involves starting with specific observations and measures, moving towards broader generalizations and theories? A. Deductive reasoning. B. Inductive reasoning. C. Intuition. Or D. Clinical judgment. Pause if you want to think about this before I give you the answer. The answer is B. Inductive reasoning. Let me explain how you can answer this question correctly on your own exam. This exam question comes from this learning objective. Describe processes of inductive and deductive reasoning in decision making. Let's go through the study process. What do we need to know in order to have an intelligent conversation about this learning objective? Well, if we want to be able to describe processes of inductive and deductive reasoning in decision making, we're going to need to know what is inductive reasoning, what is deductive reasoning, what are their processes. Once we know what they are, then we could describe that to somebody else. And we need to be able to do that in order to answer this question, because I think it becomes obvious once you know what inductive and deductive reasoning are. Now you can see that they're basically just giving us a definition, and we need to know which definition are they giving us here. Are they giving us the definition for deductive reasoning, inductive reasoning, intuition, or clinical judgment? But because we study with this learning objective question, we can immediately recognize that this is the definition for inductive reasoning. Therefore, that must be the correct answer. If you're ready for a better way to study than simply reading your textbook word for word, it is time to try a smarter way of studying that actually teaches your brain to think like a nurse. And that's exactly what I'm going to show you in the next video about the Silver Bullet study system. It's the best way to study in nursing school. And it's helped thousands of nursing students study less, understand more, and finally feel confident walking into your nursing exams. If you already know about the Silver Bullet study system and you're ready for the one question that rules them all test taking strategy, then head on over here. Either way, I'll see you there.